NeedyMeds users and friends. Thanks for joining me. I'm Carla, the Director of Education and Partnerships at NeedyMeds. And today I will explain how to find healthcare savings resources on the NeedyMeds website. First, I'll offer a few tips so you can make the most out of the presentation. You can ask questions by typing them into the questions section of your GoToWebinar control panel, but I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you by email. I will provide my contact information and the contact information for NeedyMeds at the end. This webinar is being recorded and will be posted on our YouTube channel. And you can find my PowerPoint slide deck in the handout section of your control panel. So during this webinar, I will cover what NeedyMeds is, the healthcare savings resources we offer, and how to find them and other educational tools on our website. We'll talk about the NeedyMeds drug discount card, as well as easy ways you can stay in touch with us. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Rich Sagal, who is still the president. On the screen is our mission statement, a statement about how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And one of the most popular and effective ways we do that is with our listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program. When a program is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare provider usually needs to be involved by providing a prescription, signing the application, and submitting documentation. So, how can you find prescription assistance programs and other healthcare savings resources on the NeedyMeds website? I'll transition out of the PowerPoint to our live website so I can demonstrate. As you can see, there's a ton of information on our website. Since we're going to spend most of today's webinar checking out savings resources under that patient savings tab, I encourage you to explore our site further when time allows, especially the Advocates tab, which we'll talk about a little bit later. Okay, returning to prescription assistance programs. You can always begin your search for savings programs for medications by typing the name of the drug into the drug search bar on the top left-hand side where my cursor is blinking. If you are specifically looking for prescription assistance programs, click on that Patient Savings tab. And this is where all the cost savings resources are, as you can see all these different categories popped up. The Patient Savings tab, under that, on the left-hand side, under Save on Prescriptions, is where you can find prescription assistance programs. And you can search for them a number of ways. You can search for them by the company name, by the program name, or by the most common brand name of the drug. So let's say you are looking for help affording a name brand drug, Eliquis. I'll go ahead and click on that brand name drug link. And when I do that, the first thing you're going to see on the page that will pop up, if my internet will cooperate, there we go, are a bunch of icons. Let me make that screen a little bit bigger. And what those icons do is they tell you what type of information is available for that drug. Is there a savings program available, such as a prescription assistance program or a coupon? Is there more information available about the medication through support pages, drug videos, or on drugs.com? As you scroll down, you'll also notice a convenient A to Z index to make your search easy. So again, we're searching for a name brand drug called Eliquis. So I'll choose E in the A to Z index, and then I'll scroll down the long list of medications. If you happen to find your medication listed more than once, be sure to click on every link. You don't want to miss any savings programs. So there's Eliquis. It's a hyperlink. I'll click on that, and there are those icons again. The three on the far right let me know that there is additional information available about that drug through support pages, a drug video, and on drugs.com. And the two icons on the left let me know that there are savings programs available. This icon indicating that there's a coupon, and the icon on the left indicating that there is at least one prescription assistance program. I'm going to go ahead and click on that. And currently, there are two programs available for this drug. I can tell that because in the blue bar, it reads programs 1 of 2. When there is more than one program, the program that offers the most assistance will be listed at the top, and the ones that offer lesser assistance at the bottom, and then alphabetically. Let me make the screen a bit smaller. Don't worry about reading the text. I just want you to see a snapshot of what our prescription assistance page program, our prescription assistance program pages, that's a mouthful, looks like. And as you can see, there's the first one, sponsored by Bristol Myers. And then as we scroll down, you'll see that blue bar again, differentiating one program for another. And that one actually says program 2 of 2. So let's make the screen bigger now so we can talk about the information on your page. Not surprisingly, at the top, you will always find the name of the supporting organization and their contact information. And that's really important because if you have any questions about the program, you're going to want to direct them to the program directly as opposed to NeedyMeds. Next is the application section. Most of the time, like here, you will find a link to the application itself. If not, you'll find more information about obtaining that application. Next is the medication section, which lets you know what medications are covered by this program. And then very importantly, you will find the eligibility requirements section. Now, as I had mentioned in the beginning, eligibility, like the applications, will vary from program to program. But eligibility is almost always based on 3 factors: insurance status, residency, and income. And income is often based on a certain multiple of the federal poverty level guidelines. And because that's so common, we did put a convenient federal poverty income calculator right there. So moving along, next you will find the application section. And this has information about if or how the doctor needs to be involved and the time frame for which to expect the decision. Next, you'll find another medication section, which is also important because it lets you know, for example, where the medication will be sent to and details for reapplying. Always be sure to check out that additional information section because that is where we put other pertinent information that doesn't fall neatly into the other categories. So moving on to other cost savings programs, and again, don't forget that if you do have questions, you can type them into that question section of your GoToWebinar control panel. So I'm going to go ahead and return to that patient savings tab so I can point out another cost savings section, which is our $4 generic drug discount program. This section of our website is a directory of all discount programs for generic medications available at major retailers. Now, although it's called the $4 generic discount drug program, most will range in price from $4 to up to $15 for a 30, 60, or 90-day supply. As you can see, when I scroll down, there are a number of ways you can search. You can search to see if there are stores or pharmacies in your area participating in the $4 generic discount drug program by the name of the drug. You can search by the name of the participating store or pharmacy, but you can also see what's available in your area. So just to demonstrate what the results will yield, I'm going to do an easy state search. So let's see what's available in Arizona. There are currently 4 stores or pharmacies within the state of Arizona that are participating in the $4 generic discount drug program. And I hope you'll agree that all of the pertinent information is on your screen right now, including the store name and hyperlink if available, the name of the program, and importantly, on the far right column which is labeled program, it'll let you know exactly what this program will help you to save on. So let's move on to another really popular destination on the NeedyMeds website. Returning to that patient savings tab, I'm going to click on our clinics category. I'm happy to let you know, and as you can see by this page, a couple of years ago, because this category on our website is so large, to make searches easier, we actually broke down this section into 4 categories. This way you can easily find medical clinics, dental clinics, mental health clinics, or substance addiction clinics. They are all set up the same way, so for purposes of this webinar, I'm just going to click on medical clinics. Now, as you can see, this section is really large. We have just under 17,000 free, low-cost, or sliding scale clinics in this category on our website. And you can search a number of ways. You can search really narrowly, geographically by the zip code, or you can search really broadly by state. And because this category is so large, I'm going to go ahead and do a more narrow zip code search. So let's see what's available in 94974. Let's do within 5 miles of that zip code. And the results yield there are 9 clinics within 5 miles of the 94974 zip code. And all of the pertinent information is on your screen right now, including the clinic's name, address, contact information, and website if one is available, the eligibility, meaning who can be treated at the clinic, and the details about that clinic, meaning what services does a clinic provide, and what service area do you have to reside in to be able to be seen at the clinic. Although we pride ourselves on our information being accurate and up to date, we absolutely recommend reaching out to the clinic, giving them a call, visiting their website to confirm details that may be important to you, a loved one, or a client or patient you're helping, such as what fee can the patient expect to incur, and does the staff speak other languages? Now, let's say you wanted to share this list with someone. You can do that easily by clicking the print option. But let's say you're confident that the person you're going to share this list would only be interested in 3 out of these 9 clinics. So then on the left-hand side, you can click on only the ones you think the person you're sharing this list would be interested in that box on the left. And you can choose the print instead of the print all option. This will generate and print a list, including only the clinics you chose. And again, that's a great tool, especially for healthcare providers that maybe want to provide their clients with a list of clinics for them to choose from. Now, returning to that patient savings tab, if you scroll down, you'll see a section for coupons and rebates. This is where you can find prescriptions and over-the-counter medications and supplies for which there is a coupon, a rebate, a savings card, a free sample, or a free trial offer. Just like the other categories on our website, you can search a number of ways. You can search by the name of the drug. You can search by the name of the product. But in this case, you can also search by category, which does mean medical category. Let me show you what I'm referring to. I'm going to go ahead and click on that search by category link, and then an alphabetized list of medical categories pop up to make your search easy. Now, please be vocal about your experience on our website. Are you having difficulty finding things? Is there a cost savings resource that you really need and we don't currently have it? Again, be vocal. You can do that easily by sending me an email. I'll provide my contact information at the end, but it is Carla with a C at NeedyMeds.org. And the reason I encourage you to do so is we work really hard to improve the usability of our website and the content it contains. So getting feedback from our users is really valuable. So I encourage you to help us out, and please do that. Now, aside from the prescription assistance programs, The second greatest source of savings is through our diagnosis-based assistance programs. And you can find those returning, as you guessed, to that patient savings tab and clicking on that diagnosis-based assistance link in the center. Now, diagnosis-based assistance programs are a little bit different because they provide financial assistance for costs associated with a particular diagnosis. Now, often that doesn't include medicines. What it does include instead are other necessary medical expenses like supplies, medical equipment, or things like help affording wigs or house cleaning services or assistive technology. Like the other categories on our website, you can search a number of ways. For example, you can search by the probably pretty least common way to search, the program name. You can search geographically to see what's available in your state or nationwide. And you can also search by diagnosis. So I'm going to go ahead and click on that hyperlink. And like our prescription assistance program section, because this category is so large, there is that convenient A to Z index. Just to demonstrate, I'll go ahead and click on D for diabetes. And I really like to use diabetes as an example, not only because it's so commonly diagnosed in our country, but it's a great example of a diagnosis that requires a lot of expense in addition to medication. Now, because diabetes is such a broad medical category, you will see a bunch of subcategories for it. But just to demonstrate, I'm going to click on the general link for diabetes. Currently, there are 82 diagnosis-based assistance programs for diabetes. And you may notice I keep using that word currently, or saying currently there are X number of programs, or right now there are X number of programs. That's because we update the information on our website all the time. So if you are looking for a cost savings program for a particular medication, maybe medical equipment, or related to a particular diagnosis, and you're not having luck finding it on our website, always be sure, first of all, to reach out to our call center counselors at 1-800-503-6897, and you will find that toll-free helpline at the top right of our website. But also be sure to check out our website again in the near future, because just because you're not having luck finding a cost-saving program to help your needs today, you may find one in the near future. So do be sure to check back. One other thing I wanted to just show you on this page, with the results yielding the 82 diagnosis-based assistance programs for diabetes, is like the other categories, I hope you'll agree that all of the pertinent information is now right up on your screen, including the program name and a summary about that program. And the two far right columns are what you're going to be most interested in: the services this program provides and the areas of service. Now, as you can see, a lot of times the programs offer assistance affording things like medical expenses or assistive technology, but they vary greatly. For example, this program will help a patient get respite care. These couple of programs will help someone get access to a service animal. You'll also notice under this areas of service column, you'll keep seeing the word national. That's because we put all of our national programs at the top. National meaning, regardless of where you reside in our country, you will be eligible to apply. And then under all of the national programs, you will find programs available by state alphabetically. Now, when we return to that patient savings tab, right in the center, we have a brand new section, our COVID-19 resource section. Like the other categories, you can search a couple of ways. You can search, again, probably by the least common program name, but you can also search to see what's available in your state or nationwide. Again, nationwide meaning, regardless of where you live in our country, you will be eligible to apply. And the COVID-19 Resource Center was specifically created to help those experiencing financial hardships and struggling with healthcare expenses due to the coronavirus. And this section is growing every day. And keep in mind, if you are aware of a new program or that we haven't listed, please send me an email and we'll include it immediately. I just want to click on the programs by state or nationwide just so you can see how easy it is to see what's available in your state. So I just quickly checked out to see what's available in California, and there currently are 15 programs available to help people experiencing financial hardship or trouble affording their healthcare expenses due to COVID-19. Now, returning to that patient savings tab, I'm going to make the screen a bit smaller, just so I can point out the other categories we have on this section. I'm not going to take time to go through or demonstrate each of these categories because hopefully you're starting to see that all of the sections are set up similarly to make your searches easy. We do have sections dedicated, for example, to medical transportation, as we're aware that getting to and from a doctor's office or healthcare facility can prove burdensome. We do have programs for camps, retreats, recreational programs, and educational scholarships for those living with a specific diagnosis. And I'll also point out our government programs section. This includes state-sponsored programs and pretty exhaustive Medicare and Medicaid information. Now, if you'll bear with me, I'd like to exit out of the live website and back to our PowerPoint presentation so I can talk to you about another important way you can save on your healthcare expenses, which is with the NeedyMeds drug discount card. Now, like other drug discount cards, ours works the same. The user takes the card, which can be plastic, paper, or an app on your phone, to the pharmacy, matches it with the prescription, and saves. Now, I'm sure that you've heard that there are other drug discount cards out there, but the NeedyMeds drug discount card is free and anonymous. We do not track your personal data, so confidentiality is guaranteed. There is no registration, no enrollment, no residency requirements, and no activation. And the NeedyMeds drug discount card is accepted in more than 65,000 pharmacies nationwide. You can use the drug discount card to save on up to 80% off the cash price of prescription medications. You can save on over-the-counter medications or supplies as long as they're written as prescriptions. And you can even save on human equivalent pet meds purchased at a regular pharmacy. You can also use the NeedyMeds drug discount card to save 40% off medical equipment. So the big question is, who can use the card? And the simple answer is anyone. The only rule is it cannot be combined with insurance. So if you are uninsured, you can use the card anytime. But if you do have insurance, you may choose to use the card instead. And you may do that, for example, if you find your medication isn't covered under insurance. You may find yourself in a coverage gap. You may have a high copayment or high deductible, or maybe you've exceeded a cap for drug coverage for the year. So let's return to the website so I can show you how to get your drug discount card and the tools to maximize savings. So on the left-hand side, you will see a box with a red arrow that says get your NeedyMeds drug discount card here. Clicking on that box will take you to this page where you can download and print out a PDF of the NeedyMeds drug discount card. You can download the app for free through Google Play or the iTunes App Store. You can fill out the form below, being sure to choose a design. You can also drop us a self-addressed stamped envelope. And of course, you can always reach out to our call center counselors, and they'll be happy to mail you some as soon as they can. The other thing I want to point out is at the bottom of this page, you'll find the pharmacy search. And this is exactly what it sounds like. It's where you can type in your zip code or the address of where you live or work to see what pharmacies in your area accept the NeedyMeds drug discount card. I'm going to just demonstrate really quickly by typing in a zip code. Let's do 5 miles within that zip code. And apologies, because it looks like that's a little problem we're either having with the website or it may also be my internet. But nonetheless, I recommend, because the pharmacy search has more than 65,000 participating pharmacies nationwide, do a narrow search. Search within your zip code only, or within 5 miles of that zip code if you do have access to public transportation or a vehicle. Because it's so broad, the database is so broad and large, you're going to want to be sure to do a pretty narrow search to start. And the results will yield, like the other databases, what we hope you'll agree is all the pertinent information, such as the name of the pharmacy, the address, and their contact information. Like the clinics category on our website, it will also have a hyperlink to a map showing you where the pharmacy is located if you're unsure. So now at this point, let's say you have your drug discount card. You either printed out a paper version, you've asked us to mail you a plastic card, or you've downloaded the app. You've checked out the pharmacy search, so you know what pharmacies in your area accept the NeedyMeds drug discount card. The last step is, how much will the medication cost you using the NeedyMeds drug discount card? And you can find that out also with a few clicks of the mouse by clicking on the drug pricing calculator on the top left-hand side. To find out what your medication will cost you, you will need to know 4 pieces of information: the pharmacy zip code where you would like to pick up your prescription, the prescription name, the dosage, and the day supply, meaning is the prescription valid for 30, 60, or 90-day supply, for example. This way, with the pharmacy tracker and drug calculator, you can find out where to pick up your medication and what you'll be paying before you head out the door. If you don't have access to the internet, our call center counselors can happily find out that information for you. So now I'm going to transition back to the PowerPoint, and as I do that, I will encourage you again, I see some questions coming in, to type in any questions you may have into that questions section of your GoToWebinar control panel. And I know you saw a quick snapshot of this screen before we transitioned back to the PowerPoint a few moments ago. These are a few simple ways that you can stay in touch with NeedyMeds. We are on social media, so I encourage you to follow us on Facebook and Twitter. You can subscribe to our YouTube channel so you won't miss out on any new content, such as videos, webinars, or presentations. If you subscribe, the YouTube channel will notify you when that new content is added. You can also subscribe to our blog, the NeedyMeds Voice. You can find a link to that with the rest of the social media icons and that YouTube icon, which on the top right of our homepage. And our blog is where you'll be able to read timely, provocative pieces on healthcare-related topics. Now, I also mentioned in the beginning of the presentation that I wanted to talk to you about some resources under that Advocates tab, which is just to the right of that Patient Savings tab. This is where you can find our subscription center, where you can order print materials such as our drug discount cards and brochures, and sign up for email alerts and program changes. Under that Advocates tab in the middle, you can also sign up for upcoming webinars. You can also sign up to receive our monthly e-newsletter Vitals, and you can learn about becoming a NeedyMeds Volunteer Ambassador. So with that, I want to, as promised, put up our contact information as I get to some of those questions coming in. On this page at the top, you will see an email address for my colleague, Alana. If you are interested in ordering drug discount cards or some of our most popular educational brochures, you can shoot her an email. If you have any questions regarding this webinar or the information I covered, feel free to get in touch with me directly at carla@needymeds.org. And again, it's a great way to share your experience with our website. Please take the time to peruse needymeds.org when you have time. And don't forget, our call center counselors are available at 1-800-503-6897. So let's get to some of those questions coming in. The first one is, how does the federal poverty level calculator work? Oh, that's a great question. And I'd love to actually switch out of the PowerPoint back to the website so I can demonstrate. Now, you may remember under that patient savings tab on the eligibility section, there was a federal poverty level calculator right there to make searches easy. But you can also find the federal poverty guidelines calculator under the government program section. You'll see a link to it clearly labeled federal poverty guidelines. Sorry guys, it looks like I'm having a little bit difficulty with this. And it might be our website, but it might also be my connection. But again, how the federal poverty guidelines calculator works is you simply type in two pieces of information. You type in how much money the individual makes either on a weekly, monthly, or annual basis. And when you type in that number, a few tips, that's the same number you put on your tax return form at the end of the year. And you also only want to type in digits. Don't type in periods, commas, or dollar signs. And then the only other piece of information you'll need is how many people are in this individual's family. Again, same thing you would call dependents on your tax return forms at the end of the year. Those two pieces are all the information you'll need. You'll hit calculate, and the results will quickly yield where that individual's income falls within the federal poverty guidelines. Sorry I wasn't able to demonstrate that for you, but it really is as easy as it sounds. So let's get to those other questions coming in. You mentioned you can use the NeedyMeds drug discount card to save on pet meds. How? And yes, I'm so glad you asked. We actually put together a less than 10-minute video on how to use our card to save on your pet meds. You can go to the NeedyMeds YouTube channel and type the word pets into the search bar, or you can email me and I'd be happy to send you the link. Let's see, another question coming in. Can people who are not legal residents apply for the card? So that's a fantastic question and something I really am pleased to say, which is that our NeedyMeds drug discount card, because it is free and anonymous and has no identifying information, anybody can use the card. I also want to point out that because the card is anonymous, many people can use the same card. So you can print out the card once, you could have one plastic card, and you can share that same card with your friends, your family, your neighbors, and your loved ones. And yes, you do not have to have documentation to reside in our country to use that NeedyMeds drug discount card. It's a great safety net if there is a medication you need that isn't covered, and anybody can use it. This topic also gives me the opportunity to say that there are other programs that require residency, such as prescription assistance programs. They usually are talking about, I shouldn't say usually, many times, often, they are, when they're talking about residency, they're really talking about whether or not the person resides in our country or is living in our country. It doesn't necessarily mean is the person documented or is the person a citizen. You can check out, you'll see that, the answer to that under the eligibility section of our prescription assistance program pages. It will give you specific information. But again, if you're unsure about whether or not somebody you're attempting to help is eligible, do not hesitate to reach out to the prescription assistance program directly. And again, you will find all of that information on the top of the prescription assistance program pages. Another question, does NeedyMeds offer programs to cover radiology fees or anything related to radiology or imaging? Unfortunately, we do not. We do have some articles, however, on our blog. So if you go to the NeedyMeds Voice, which is the name of our blog, and again, you can find an icon on that for the blog on the top right hand of the NeedyMeds website. It's an orange icon that says blog. If you click on that, it will take you to the NeedyMeds Voice, and there'll be a search option. If you type in radiology, you'll be able to find pretty recent articles on that will provide you with tips on how to find reliable and affordable radiology or imaging centers where you live. another fantastic question, which is, what are the days and times for the helpline? Thank you for that question. So the NeedyMeds helpline, the toll-free helpline at 1-800-503-6897 is open Monday through Friday, 9 a.m. to 5 p.m. Keep in mind, NeedyMeds is located in Massachusetts, so we are on East Coast time, and we do have Spanish-speaking counselors. Thanks for that question. So another question that we get regularly is about if someone has Medicare and is in a match for a prescription assistance program, will that individual be able to provide, will NeedyMeds be able to find other cost savings programs? And the answer is it depends. So as I had mentioned in the beginning of the presentation, when we talk about prescription assistance programs, eligibility requirements will vary from program to program. Now, oftentimes, Medicare recipients are not eligible, but that's not always the case, so it's worth checking out. And that's true of our other sections as well. So just because somebody has Medicare or Medicaid doesn't automatically preclude them from being eligible for a cost savings program. Now, what I always recommend is if you are looking for help affording a name brand medication, check out that prescription assistance program section first. Again, that's because prescription assistance programs will usually provide you with the medication for free or a very discounted rate. Also in that prescription assistance program section, you'll also find out whether or not a coupon is available. So if you're not eligible for a prescription assistance program, maybe there's a coupon available. If that's not available, you can always check out the DiagnosisBased assistance program section to see if there is a cost savings program related to your diagnosis, and that may include help affording a medication. And if none of that works, we do have the NeedyMeds drug discount card as a safety net. Now, keep in mind that the NeedyMeds drug discount card cannot be combined with insurance. So if you have health insurance, if you have drug coverage, if you have Medicare or Medicaid, you can choose to use the NeedyMeds drug discount card instead of that coverage, but you cannot use it combined with that coverage. I hope that makes sense. If you are looking for more information about specific NeedyMeds resources, I suggest checking out the NeedyMeds YouTube channel. You can find all of our previously recorded webinars, presentations, and videos. And on there, along with the 10-minute video about how to use the NeedyMeds drug discount card to save on pet meds, you will also find 10 to 15-minute videos on prescription assistance programs and diagnosis-based assistance programs, as well as about a 15 to 20-minute video called Demystifying the Drug Discount Card, which is everything you ever wanted to know about the NeedyMeds drug discount card. So do check that out. So I try to keep the question segment brief. So if you asked a question I didn't get the chance to answer, I'm happy to follow up with you, or you can always reach out to our call center counselors. Again, that toll-free helpline is on your screen right now, and we are open Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. Thank you again for taking the time to join me today to learn about NeedyMeds and the healthcare savings and educational resources we offer. And I do hope to see your name pop up for future webinars. Stay safe. Thanks again, and have a great rest of the day.